version 2, 85 questions, high-yield topics, very straightforward questions. This one is designed to mimic the exams itself. So as you go through the case, you get harder and harder and harder. So you may have to stick around and see the harder questions. The first few ones are easy, but they are straightforward, critical thinking cases. So let's get to it. Straightforward. This is the first case. A client with pancreatitis was noted to have systolic blood pressure of 80, heart rate of 130. The lung sound is clear. Saturation 99% in room air. Mark the areas the nurse should examine immediately. Test taking skills. I have what? Pancreatitis, buzzwords, all of a sudden have hypotension and tachycardia. This is what? Shock. I mean shock. My lung sounds are clear, so it has nothing to do with my lung. Where would you know if I have pancreatitis? You have to mark to show that I'm bleeding. Yes, periumbilical area and flank ecchymosis. So this area, yes, Kelly sign and Gray Turner sign. So you mark those sides, that's where you should be looking for hemorrhage. Straightforward test taking skills, very important topic you have to know those areas. Question 1, down. Number 2, what do you think? Select or apply. Reading from the back. Which of the following lab values the nurse should expect? I'm expecting certain lab value. Then underline your keywords. A new nurse is caring for a client with what? NG tube on low continuous suction for 3 days to decompress the GI tract due to small bowel obstruction. The provider ordered a BMP and ABG. Which of the following lab values the nurse should expect? It's a test taking skills. Bringing your content. If I have NG tube for 3 days, what lab work do I expect? You see, I've used the content, break down my the question, and I've given you the buzzword. This is all you need. NG tube for 3 days. What do you think? Your stomach has acid in it, and the acid that is coming out is either ACL or sodium chloride. So you're going to lose sodium. It's going to go down. Your chloride is going to go down. Your body will figure out that you're losing sodium, and it tells the kidney, hey, kidney, you need to get rid of potassium and take in sodium. So you end up losing your potassium too. Since you're losing all your acid away, your bicarb goes up. So you have increased bicarb. And this becomes what? Metabolic alkalosis. So I have metabolic alkalosis. How do I control I compensate for metabolic alkalosis? Respiratory acidosis. So metabolic alkalosis, I will take care of it with respiratory acidosis. Your CO2 should go up. Your chloride, I told you, it goes down. Your pH, yes, is an alkalosis. The pH does not go down. That's different. pH, because it's metabolic alkalosis, pH should go up. Potassium is what? Low. Sodium is low. So the lab work is expected is 1, low sodium, and a PCO2 of high because I'm compensating for metabolic alkalosis. I will do respiratory acidosis. Chloride will be low, pH will be high, potassium will be low. This is the lab work. The case that requires a lot of thinking, critical thinking, and bringing your content. Straightforward. Number 2 down. Which order the nurse should anticipate first? A new nurse was assigned a client with the type 1 diabetes, who present to the emergency room with what? Fatigue, polydipsia, fruity smell, lab work, pH of 7.2, finger stick 300, and EKG, I see a peak wave. What do you think? A bunch of words, put it together. Type 1 diabetes patient with what? Some EKG changes, therefore I have potassium that is high. Glucose is over 300, right? I smell fruity, that means I have some ketones, right? My pH is 7.2, 3, therefore I have DKA. What do you do? Number one treatment of DKA, don't give them insulin. This potassium, if you correct it right away, the potassium is already high. Why do you want to give them potassium right away, right now? No. Saline bolus will control all this problem. You don't need to check for ketones. It's not going to help you. You already had a fruity smell. You can feel it. Like, that's the problem. So DKA, other than issue anticipate first, is saline bolus. Straightforward. Next question. Which client do you see first? Would you want to see? You got to be sharp. How do you be sharp? Breathing issue, electrolyte, shock sepsis, hypothermia, airway, lethargy, and pain. Be sharp. Check my YouTube channel for be sharp prioritization. You can answer any question. Nothing can beat you. It's expected and unexpected finding using the be sharp. Pancreatitis and itis, I see what? Amylase. This is what I expect when you have inflammation of the pancreas. Lipase goes up. The normal doesn't matter. Whether it's 1 million, it does not matter. Chronic liver disease. Your liver doesn't work. What do you think? You take care of coagulation factors. If it doesn't work, it cannot make coagulation factors. INI is going to be high. Chronic kidney disease. The most common indicator of kidney function is creatinine. If you have chronic kidney disease, well, the creatinine is 2.1. I left the disease here. Heart failure, what do you think? Definition of heart failure is BNP of 900. The normal does not matter. So this you don't have to worry about. When you have lupus and you have kidney dysfunction, that's deadly. This is what kills them. So lupus with nephropathy is your priority. That's bad diagnosis. End stage of lupus is not good. So I have to see this patient. They're not doing well. Next question. Selected apply. Which of these should the nurse include when teaching the new nurse about causes of conduction hearing loss? So this is the key. Factors that lead to conduction hearing loss. And nurse is orienting new nurses to the med-surg units. The team was assigned a client with conduction hearing. Conduction, look at it. Conduction. Something is going through something. If you have conduction hearing, that means something is blocking the conduction going through. It has nothing to do with the nerve itself. So if this is the ear canal and you want to hear, there's something blocking it. Vancomycin does not even go to your ear. It affects it from the distance. If you're affecting it from the distance, that means you are affecting the nerve, something systemic. Diabetes can affect the nerve systemic. Cerumen, yeah. That means this is some Goomba inside your ear that is causing you not to hear. You got to clean your ears. Excessive noise, it does not go into your ears to affect it. It's far away. So this is not. It's all causes sensory neural hearing loss. Infection, yeah, it goes there and you have infection here like that. Damage to the nerve is a nerve problem. So that is sensory neural. So this is sensory neural, sensory neural. This is sensory neural, sensory. But the two that cause conduction is 3 and 5. Test taking skills. That's the way you answer the question. Take their question and rewrite it for them. What do you have? Which action the nurse should perform before the ABG? Okay, what do I need to do? A nurse is caring for intubated client due to ARDS. ABG was ordered to help titrate the vent setting. Every time you want to do ABG, what? You assess Allen test. But what do you assess for? For perfusion of the ulna, not the radio. You want to make sure the ulna is dominant so that when you damage the radio, the ulna is still functioning. If the individual depend on the radio and you damage it, then they're going to lose their hand. So this is the hand. There's an ulna going here and the radio. The radio is mostly medial. And so if you damage it, and their honor is not intact, you get into trouble. And so the Allen test is used to assess some artery, but it's to mostly for perfusion of the honor. Avoid suctioning the client before the blood draw. Yes. You should not hyperventilate when you're about to draw ABG. You should not put the patient in any change in position. Change in position will affect the ABG. The patient will start coughing, it will cause a problem. So don't change the position. Don't hyperventilate. When you do the Allen test, you're looking for arterial ulna and don't suction the patient. So what you know you should do, avoid suctioning the patient before you draw ABG. That's the fact you have to know. Select or apply. Same thing, right? And nurse is caring for a 12-hour-old term infant. It's just less than 24 hours, half a day. Which assessment finding need further work? Okay, this is a term baby, right? Yellow skin, yes, it's a problem. Jaundice in the first 24 hours is a problem. So epical pulse when I'm crying, yeah, usually 110 to 160. That's their pulse. And when they're crying, it can go to 180. So I don't need to worry about it. Respiratory rate is 30 to 60. That's fine. Absent red reflex, yeah, it may indicate retinoblastoma, glaucoma, or retinal problem. So you got to watch that. When the kid is crying vigorously, oh, I love you, they're good. Head circumference usually 33 to 35 centimeters. And then the difference between the head circumference and the chest is just 2 to 3 difference. So 2 to 3 difference. So 30 and 33 is good. So this is good. So I don't need to worry about it. I don't need to worry about it. This is head. If you know head circumference, you know chest circumference. Just subtract 2 to 3 from it. Vigorous crying, I don't need to worry about it. Absent red reflex, yeah. This is normal. This is normal. So 1 and 4 are my friend. Number 8. Select or apply. Same thing. All the things will be select or apply, most of them. Which of the following the nurse should include in the teaching? A nurse is teaching new graduate about Addison disease. What is Addison disease? I have no ADO. I have no corticosteroid. If you don't have ADO, you have no sodium. If you don't have sodium, you have no potassium. Therefore, what is the problem? My potassium should be high, so this is wrong. My sodium should be low. Then steroid. Steroid, if you don't have steroid, your glucose is low. So glucose is low. Since you have low sodium, your blood pressure should be low. This is high. Wrong. You see I'm getting it? And because of the dehydration, they have abdominal pain. And this is related to the pigmentation of the ACTH. We don't need to go into detail. Check my website. You can understand how they develop brown pigmentation. But this is 1, 2. They are hyperkalemic. They have hyponatremia. They have hypoglycemia. The blood pressure is usually low. It's not high. So those are the key factors you have to know. So 1, 2, 4, and 5. These are the things you should include in the teaching. Number 9. Mark the area the physician will palpate. Where would they palpate? A client presents to the emergency room with what? Abdominal pain, number 1, nausea, and anorexia. Does not want to eat, right? The provider palpates what? McBurney's point. So mark Benny's point. To make the diagnosis, where do you think they provide a pipette? The anterior superior iliac spine, you draw a line to the umbilicus here, and 2/3. So 2/3 from here, not 2/3 from here. 2/3 from the umbilicus, 2/3 will be right here. So this is where they provide a pipette. So 2/3 is this. This is where a pipette, and this is for diagnosis for appendicitis. So this is me trying to confuse you, but I'm trying to give you key facts, you know, how to diagnose appendicitis. Is here 2/3 from the umbilicus to the anterior superior iliac spine. Okay. Number 10. Selected apply. Which of the following the nurse should anticipate on assessment? A nurse is caring for a client with severe varicose vein leading to venous disease. All he's saying is, I have venous disease. What do you see? It's peripheral venous disease. It's not arterial. So your feet is not going to be cold. You develop an ulcer above the ankle, and it's beefy red because there's too much blood going there. Because there's too much blood, you get leg edema. You have too much blood, there's no way you can get gangrene. Okay, pain with elevation. Because there's too much blood going to the leg, you have pain when you are upright. So when you elevate your leg, your pain get better. So you should not get pain when you elevate it. Your pulses is going to be normal. So 2, 3, and 6 are your right answer. 2, 3, and 6 are your right answer. 4 is wrong. 2, 3, 6. Right answer. Next question. Number 11. SATA. A nurse is caring for a client prescribed what? Aripiprazole. Abilify. That's the trade name that they sell it all the time. You hear about the Abilify. That's the way they sell it. Antipsychotic. It's called Abilify. Antipsychotic. And then which condition is it going to treat? Antipsychotic. It's schizophrenic. That's what we use it for. We treat both positive sign and negative sign. This is the only medication that can do both. It can do both positive and negative sign. So disorganized thought is positive sign. Delusion, positive sign. Hallucination, positive sign. Catatonic and flat affect, they are on negative sign. But it can treat all of them. So all of them is right answer. So that's Abilify. It's a good medication. This is a mini case for you. A G1P1 36-week client present to the LND with acute onset of vaginal bleeding. She's bleeding. Which assessment finding associated with the bleeding is consistent with the diagnosis shown? Keywords. Patient G1P0 36 weeks bleeding. Which of these, if I have previa, which one do I see? If I have placenta abruption or uterine rupture, what do I see? So I'll take a previa. Painless bleeding, yeah, less painful. Abdominal pain, no. They have rigid abdomen, no. Fetal deceleration, usually the fetus does not have any problem. Loss of fetal station, no. Abruption, pain is bleeding, is pain. So abdominal pain, yeah. Your abdomen will be rigid, peritoneal. Deceleration, yeah. You don't have loss of fetal station. Uterine rupture, bleeding is painful. You have abdominal pain. You have rigid abdomen, fetal deceleration, and loss of fetal station. This is how you can distinguish all of them. So test taking skills using the idea and breaking everything down. Okay. Number 13. What do you see? Calculation. Calculate the units per hour. Then I write it, unit an hour. The client receive. A nurse is caring for a client with DVT, right? The nurse receive an order. So what is the order? 2 ml of heparin per hour. That is the prescribed dose. The pharmacy supply. So the supply is what? Heparin 200 units per 250 ml. My answer has to be unit, has to be on top. So I'll put 200 units on top over 250 ml. Cancel the ml. Cancel this. Now I have what? 40 over 25 units per ml. So this give you like 1.6 units per hour. That's how much the heparin will be flowing. 1.6 units per hour. That's all. Straightforward dimensional analysis. Number 14. Select or apply. Same thing, right? And then you question an order for accables for a client with diabetes type 2 and which of the following condition? So, and then you question an order for accables for a client with type 2 diabetes type 2, and which of the following conditions? So I have type 2 diabetes. I've been prescribed accables. Which of these, if I have it, the next question. Accables, as you can see, are carbo. So carbohydrate. It prevents carbohydrate absorption in the GI tract. But it has certain side effects. It causes a lot of gas. So you should avoid it in IBS patients. They affect the liver. So if you have chronic, have always liver disease. That's why they have esophageal varices. So you should avoid it. This requires a lot of thinking. It also causes anemia. Therefore, this, and this should all be questioned. All of them need to be questioned. Number 15. What is the next priority action? A 15-year-old boy was brought into the emergency room after sudden, right away, onset of severe left testicular pain while playing basketball. Sudden onset of testicular pain is always testicular torsion. And this is an emergency. This is a pain that you're going to lose your limb. So you should notify the provider. Morphine will not save anything. They need emergency surgery, and you need the doctor know. Warm compression is not going to help anything. Elevating the scrotum is not going to do anything. Need to notify. This is sudden onset of severe testicular pain. Is always torsion, and you need to be untouched. They need to go to the emergency, the operating room right away. Next question. Priority case. A nurse is caring for a 1 day. It's a preterm, so pay attention. Female infant. The following assessment were noted. Baby, so this is baby started when the bed was pushed, right? This is Monroe, right? Monroe reflex, so this is fine. Labia is swollen. This is also expected. Fine area on the back and shoulder. Yeah, this is Linugo. It's okay, right? Heart rate is fine. White pinpoint purple on the face. This Malia. Hand and feet, or milia, whatever you want to call it. Hand and feet, blue acranosis. Yeah, that's fine. One crease on the sole. This is consistent with the preterm babies. Stroking of the lateral aspect of the feet and the toe fans down. Toe is supposed to fan up. And that is Babinski. This one is going down. So they said, which of the following finding need further workup is that one? This is fine. This is Monroe reflex. This is Lanugo is expected. This is Milia is expected. They are like sebaceous cyst. And this is one crease on the sole is because they are premature. Yeah, they have just a single crease. But if they are toe fan down when you stroke the lateral aspect, that means negative Babinski. That's a problem. You want the tool to find out in the kid's presence of Babinski. So this is your problem. Next question. Which of the following action the nurse should perform to confirm tube placement? A nurse is caring for a client with small bowel obstruction. NG tube was placed by the nurse. The best way to confirm placement of NG tube is not the gastric. You get a pH. It's not always the consistent. If you listen, it's never the best. If you aspirate to look for green stuff coming out, it's never the best. Even though we know probably it's in the stomach, you don't know, or in the small in the right place. But the best way is radiographic confirmation, obtain X-ray. So pH is okay, but it's not the best. Listening is okay, but it's not the best. Aspirating for bar is not the best. Best is X-ray. Next question. This is pharmacology, combination, SATA. A nurse is caring for 4 clients, so it may be 5 clients. 5 clients. Which medication combination MD need MD notification immediately? That means I have to tell the doctor. If there's a combination problem, I'm worried about citalopram, SSRI, and phenoxin. This is MAOIs. This will lead to serotonin syndrome. Yeah, we got to call. Tricyclopramine and a cough syrup. This is another word. MAOI and cough syrup. This is will lead to hypertensive urgency. You should not do that. Buspirone is for anxiety and SSRI. Yeah, you can take it. Clonazepam, this is a benzos and SSRI. Yeah, this is for this, and this can be used for anxiety, and you can take antidepressant medication with that. Aprazolam is a benzo where you have diphenhydramine. They are all sedative medication. You can't combine 2 sedative medications. So this need immediate intervention. So 1, 2, and 5 is a problem. We need to intervene as soon as possible. So that requires an intervention. Next question. The nurse should suspect a priority diagnosis of what? The client presents to the emergency room with what? Inspiration chest pain. When you breathe, you have chest pain for 3 days. The pain gets better by leaning forward. I'm underlying bars with chest pain that is resolved by leaning forward. You should know by now. Client has history of systemic lupus. So he has lupus. Temperature is 99, heart rate 86, blood pressure is 130, saline 99%, denied tobacco, no sick contact. The nurse should suspect the primary diagnosis when you have inspiration pain that is relieved by leaning forward. It's not acute coronary syndrome. It's not rib fracture. Rib fracture doesn't go away when you do that. So it does not go away when you do that. Lean forward. It's no pneumonia. It's pericarditis, and it's no myocardial infarct. That's classic for pericarditis. Same story. 6 hours later, right? Now, the same patient, 6 hours later, okay, if you read it, the same thing. Blood pressure is now 80/60, and the patient has JVD. Think about it. Pericarditis is constriction, something on your heart and the covering of your heart. The tissue over there is either thickened or is inflamed. It prevents your heart from pumping. And if it gets worse, it causes constrictive pericarditis. This can lead to cardiac tamponade. So this is what the patient is showing, hypotensive and JVD. So this patient developed constricted pericarditis, now has developed cardiac tamponade, most likely. So what additional symptoms the nurse should expect? You're not going to be hypertensive. You're going to be hypotensive. There's nothing going to change about breath sound. Your heart sound will look muffled. And you have pauses paradoxical. When you take a deep breath, your systolic blood pressure decreases. So this is additional. So this is a case form. I just did only 2 portions of it, but you can expect to get this like that. Patient with systemic lupus has developed pericarditis and is causing a cardiac temporal from constriction. So that's that question. Number 21. Which drug is indicated? A client presents to the emergency room with what? Excessive salivation. I'm salivating. I have diarrhea, nausea, vomiting. My urine output is high. Right? Examination show what? Constricted pupil and blurred vision. What do you think? You peeing too much. You have diarrhea. Everything is going up. You peeing. So bladder, GI tract, and saliva. You know that this is what cholinergic effect. This patient is on fire. What will you give it? Physiostigmine will increase your acetylcholine, so it's wrong. Endophonia will do the same thing. Of course, acetylcholine, increase acetylcholine. This will lead to cholinergic. So the best answer is anticholinergic, which is what? Atropine. And this was assessing a 5-year-old client who wear glasses, visual acuity, which report will result ophthalmology referral, which results the best thing when you're doing visual acuity for kids, you want to read at least for every line, read 4 out of 6, and then you pass that line. Anything less than that, yeah, we need to go see ophthalmology. So this is good, this is good, this is good, this is wrong. So that's the answer. It's just facts. I'll give you facts, answer the question quickly, but that's all you need. The fact is all you need. The client presents to the emergency room with what? Abdominal pain. I have nausea. I have low-grade fever. The client has a positive Murphy sign. Mark the area that will elicit. Where is Murphy? This is it. Look at it. Abdominal pain, nausea, and low-grade fever, Murphy sign. This is related to your gallbladder. It does not have a lot of information, but the Murphy sign should be your clue. Gallbladder is right upper quadrant, so it should be somewhere here like that. So this is where the provider palpated. And the patient has pain there. So that's your right answer. What do we have? 25-year-old client presents to the emergency room with abdominal pain. It's a female. Client endorses what? He has nausea, vomiting, and he does not want to eat. No prior episode, never had this before. No fever, chills. Temperature is 100. Heart rate is also 100. Blood pressure is 110, 170. Sardine 98%. Last menstrual period was 6 weeks, so she's late. No prior surgery. She's never had any surgery. So which of these is indicated? Think about it. After abdominal pain, nausea, vomiting. I never had it before. Somebody has last menstrual period, just similar to that 6 weeks ago and never had any surgery. What do you think? Even if you don't know the diagnosis, it's a GI problem. If you have GI problem, you got to be NPO. We need IV fluid. We don't need EGD, right? I'm not bleeding from my mouth or anything like that. Pain management here, how it is. We got to give you something. Of course, you got to look inside, CT scan to make a diagnosis. And then she's a female. She get a pregnancy test. She's late for 6 weeks. If that's what you have. Next question. Which medication the nurse should anticipate to be prescribed daily? A nurse is caring for a client with claudication. So I have claudication. I want to walk better. So what would you use? Protein is blood. Heparin, no. Heparin is not used for that information. It's used to prevent clots, but that's not what we prevent. Tylenol is not going to help with it. This is the medication. Improve your claudication and the number of distance you go. Pentocephalin. So that's a key medication you need to know. 26. A client presented to the emergency room with what? Amenorrhea for 8 weeks. So late for 8 weeks. Beta ACG was positive. Now we know she's pregnant. Which of the following indicate presumptive diagnosis? Presumptive. What the patient told you. Okay. It's not probable and it's not positive. Probable is the physical exams you did, and positive means intrauterine confirmation. So they will have nausea, they will have vomit, they will have breast tenderness. These two are probable signs, and this is positive signs. So 1, 2, and 3 are your answer. A client with new ileostomy is receiving teaching from the nurse at discharge regarding skincare. This is mostly skincare. Which of the following need immediate intervention? So, teaching them for skincare, how to protect the skin. Use stoma powder to keep the wafer in place. Yeah, you put a stoma powder on it so that the wafer can stick much better, so that you don't have to rip it multiple times. Clean the skin with alcohol. Alcohol keep the area dry and it worsens the problem. So no alcohol wipes. Clean the skin with mild soap and water. Yeah, mild soap and water, and you can pat dry. Use stoma adhesive to remove the adhesive removal to remove the wafer. Yeah, so that you can put it under the wafer slowly to remove it so that you can rip the skin. So this alcohol is not the right thing. The best thing is soap and water. And then she's teaching a client with osteoporosis about diet enriched with both calcium and vitamin D. Which diets the nurse should include in the teaching? So talking about vitamin D and calcium. So sardine, yogurt, milk, and fortified cereal are for both. This is not both. So he has his own, but it's calcium. This is very good for calcium. And egg yolk is good for vitamin D. The oily stuff is mostly vitamin D. So that's what you have. Number 30. Which client should be seen first? I'm on furosemide, right? And I have sunburn after exposure to sun. This is what is expected. It's photosensitivity. It's a sulfur drug. So that's not a problem. Okay. I'm on omeprazole and perfuse diarrhea 7 times a day. So I have PPI. If I have PPI, all of a sudden I'm having bad vomit 7 times a day and it's a lot of diarrhea. Yeah, you need to see me. This is a C. diff. It's a complication of antacid. Captopril, and potassium. This is increases your potassium. So if the potassium is 3.4, you're going to go up. So don't worry about it. But Framping and orange red urine, that's what happens. Stain your glasses, your cry, every discharge, orange yellow. So this is not a problem. So that's it. Okay. Number 31. Let's go. Selected apply. A client was prescribed buspirone for generalized anxiety disorder. Which teaching by the new graduate need intervention by the child? You should be familiar with this medication. This is an anxiety medication. Okay. It's anxiety medication, but it's very good compared to benzos. It has no sedative effect. It has no dependence, and you can drive with it, no problem. So, okay. So which teaching by the new graduate need intervention. So you can drive with it. So this is not a problem. It takes some time, 2 to 4 weeks to take effect. So that's fine. Can be used for a long-term treatment because it does not cause dependence issue. Severe withdrawal symptoms. No, there's no withdrawal symptoms. You may discuss dependence issue with your PCP. There's no dependent symptoms. You are the one taking care of the patient. You should talk to the patient about it, side effect. So 4 and 5, your right answer. Normal 32. Who need to be seen first? And nurse is caring for client. I have AFib. My heart rate is this, nothing. You don't need to see me. Coronary angioplasty, I know is bad, but my MAP is 665, 1 hour post procedure. I'm not bleeding. I'm okay. Severe claudication and acute onset of abdominal pain. Every time a patient has claudication, think about it. That if this is the heart and the vessel is coming, you go into the leg and they have claudication. Guess what? All these vessels, claudication, it just means you have atherosclerosis. So this may be probably blocked. So that's what the patient is complaining about. Um, the blockage here can lead to rupture, and this patient has acute aortic aneurysm that may have rupture. So this patient need to be seen. Heart failure BNP of 780 is suspected finding. So 3 is the major problem. Next question. Which cranial nerve should be included in a teaching? A nurse is teaching new graduate about high movement. So the cranial nerve involved is usually 3, 4, and 6. So 3, 4, and 6 are the one involved in high movement. Everybody does its function. Number 34. Which of the highlighted information need follow-up? A client with colon cancer underwent right colon resection. 24 hours after the surgery, the the nurse documented the following. I have temperature, heart rate 80, blood pressure 130/70, respiratory 30, saturation. I'm starting 95% on 15 liters. That's not good. I'm very anxious. I'm breathing. My abdomen is soft. Incision is okay. There's small stain of blood and there's calf tenderness and bigger than the right. What do you think? A bunch of buzzwords, and I've underlined some of them. So this calf is bigger and some tenderness, and it's anxious. The side is 95. Yeah. So this patient has DVT that has progressed into pulmonary embolism. And that is what is presented. So for those highlighted information, yeah, I'm worried about this. Anxiety, I'm worried about it. Staying with red, I'm not worried. And all of this, I'm worried about it. Not the stain with blood. A client presents to the emergency room claiming to be in labor. Which information the nurse should look for to indicate the true labor assessment? So which of these do you know they have true labor? Pain from the lower back to the lower abdomen to the lower back. It's the opposite. Pain improve with walking. It should not improve with walking. Pain intensity increases, yes. And the pain does not change cervical dilation. Sure, that's fine. But you, um, to show that it's in true labor, the pain intensity has to increase. They have to be changed in cervical and effacement, and then walking did not improve it. So those are the key words. And this is teaching new graduate about CPR techniques for a 1-year-old in cardiac arrest. Which of the following the next should include? There's a reason why there's an age there. It's a 1-year-old. How do you do CPR? 2 compression per ventilation for 1 rescuer. Yeah. If 2 to 20, 30 to 2 compression ventilation for 2. When somebody come and help you and there's 2 people, it's usually 15 to 2 because there's 2 people. Compression rate of 100 to that. That's good. So this is good. This is good. 2 finger or 2 thumbs to on the sternum for compression. Yeah. Check pulse at the brachial. Yes. And then depth of your compression is 2 inches at least. Yeah. So those are your right answer. Number 2 is the only one that is so hard. Satan, which position the nurse should know may affect? It may affect labor. A client present with labor and delivery reporting to be in labor. Transabdominal ultrasound was obtained. Which one will affect labor? The best position is what? Left occipital anterior, right occipital anterior. So left, right is good. This guy is your right answer. 3, 4, 5 is your right answer right there. And that's the only one that will help with the position is, so this is the left and left occipital anterior, right occipital anterior. So it show you which one usually presentation will okay and how you can figure out with that. Okay, number 38. Which of the following the nurse should expect in the initial assessment? A client, a nurse is caring for a 15-year-old boy whose mother is heroin addict and reports using the drug throughout the pregnancy. Which of these should be expected in assessment? There is a key here. When your parent did the drug and they deliver you, the first 24 hours, you have the drug on board, intoxicated. So you are very intoxicated. After 24 hours, you develop withdrawal symptoms. So this patient is going to be intoxicated. Yawning is a withdrawal. Tachycardia is a withdrawal because this is a downer. Diarrhea is a withdrawal symptom. So patient is going to be very sleepy. A little bit harder, one of the hard questions, but if you break it down, you can figure it out. 39. A couple presented the genetic counseling for evaluation. Both couples have sickle cell trait. The client wants to know their chance of having a sickle cell child. What should be the next response? Well, both of them are what? Sickle cell trait. So they have AS and AS. So you can cross them. AA is fine. So one of the child will be good. AS, yeah, AS, and then this one will go to another AS and SS. So you have completely normal AA, career, and the disease, but 3 out of 4 will be normal and 1/4 will be will have a sickle cell disease every time they have pregnancy. So it's 1/4. So 25% chance of getting that. Number 40. A newborn with jaundice is receiving phototherapy. Which of the following is appropriate or not? So when you're getting phototherapy, which one is appropriate or not? Monitor your urine output. Yeah, I want to know whether you pee. Breastfeeding. Yeah, patient need nutrition. Okay. You need to cover the genitalia and they wear high protection. Last question, answer choice. This is very deceiving. They don't get lotion. Lotions will cause burn. It absorb heat and it can cause burn. So you should not avoid it in this patient. Same question. Same strategy. Select or apply, right? Which infection control actions are appropriate by the nurse? Appropriate by the nurse. A nurse received a report from the emergency room about a client with excessive diarrhea due to Shigella. Which infection control is appropriate? You always have to recognize the organism. Shigella, what is a precaution? It's a contact. How do I know? It's an enteric problem. Enteric. Every time there's enteric, it's a contact precaution. Do I need a negative room? No. Do I need a private room? Yes. Do I need to close the door? No, because it's contact. If you hear and I come here, I'm touching you, yeah, I'll get it. But if your door is here, I'm walking here, there's no way I'll get it. The door may, the word is may be closed. It does not need to be closed. Single-use equipment, excellent. Gown in the patient room. The patient room is infected. I should wear the gown outside before I come into the patient room. And before I leave, I remove the gown and put it in the basket over there before I leave the room. So the gown should be outside, right? So which infection control action are appropriate by the nurse? Private room is good. The door does not need to be closed. Single equipment, but the gown should not be in the patient room. It should be outside. So the appropriate function is private room and single equipment use. That's all. These questions, you have to master it. If you master it, you'll be fine in the test. Select or apply. I told you everything, most of the questions are select or apply because I like SATA. Which lab work to make it comfortable for you? Which lab work the nurse should anticipate? Okay. The nurse is caring for a client with chronic kidney disease. Buzzwords, chronic kidney disease. What lab work do I expect? The kidney does not function anymore. Kidney is where you release erythropoietin to make what? Hemoglobin. If you have kidney disease, your hemoglobin should be lower. It should not be normal. The kidney is where we get rid of potassium. Potassium should be higher, 4.9, close to being higher. Calcium is the same place where we help with the reabsorption and everything, PTH and all those things. Calcium is usually low. Phosphorus supposed to be high. This seems to be low, or it's in the normal range. I expect the phosphorus to be a little bit higher than that. Today, most people, their phosphorus is very high because their calcium is low. And the sodium can be high and low, but mostly because of fluid overload, they look like that. Somebody will pick 3, I'm not picking. I expect normal phosphorus is 4. These people, maybe 4.5, 5, because they are on phosphor binders. They take things to decrease the level of their phosphorus. So 1, 2, 3, and 5. This level is normal. I don't expect their phosphorus unless they're taking something for it. Select or apply. Same thing, right? Which teaching is effective? Effective teaching. I keep on underlining the keywords. Effective teaching. The female client was prescribed streptomycin as part of TB therapy, right? you have to bring your content and you tell yourself, I have TB, I've been given streptomycin. Which teaching is effective? Before you answer the question, come out with your content. I know this is aminoglycoside, very notorious. Your kidney is in trouble, right? Your ear is in trouble. Sometimes they affect your liver too. So they're very, very bad medication. Yes. So what teaching we provide? Avoid NSAID. Why? This is your kidney. I don't want anything to affect my kidney too much. So yes, call your PCP with ringing in your ear. Okay, ringing in your ear. Yeah, that's autotoxicity affecting your ear. So this is good. Ensure barrier method for contraception. They are also teratogens. Why do I need to drink 2 to 3 liters of water? Because of your kidney. You need lab draw frequently. Yes, I want to check your creatinine. Make sure I'm not destroying your kidney. You will need your medication for 3 months. It's a TB medication, at least 9 months. So which teaching is effective? 1, 2, 3, 4, 5. Now what is effective? Next question, selected apply. So it's the same thing. Which of the following the next should question? Same thing, I need to question. A female client was prescribed erythromycin for urinary tract infection. So urinary tract infection. Which one I should question? Recognize this antibiotic. This is a mycin group. Clarithromycin, the same group. The macrolates. Macrolates are very notorious for QT prolongation. That's their thing. They love it. Therefore, any medication that affects QT prolongation is a problem. You see how I answer question? I read it, buzzword, I find the buzzword, and I see what content do I need right away to answer the question. Boom, QT prolongation for a macrolate. Dancitron, love QT. Amiodarone, love QT. Magnesium of 1 gram, guess what? QT. Clozapine, love QT. Need frequent lab draw? No, you don't need that. It's not like aminoglycoside, chloride. But which of the following the next should question? I love 1, 2, 3, and 4. The nurse is caring for a client with tertiary syphilis. These questions are straightforward. The nurse should assess the client for what? We have primary, okay, syphilis, and we have secondary, we have latent, and then tertiary syphilis. This is where you have the chancre, and then they'll progress to like painless. This chancre is a painless penile or ulcer in the genital area. It's not painful. They develop lymphadenopathy, like and generalized lymphadenopathy, like secondary infection. Then the disease, that's where they are very infectious, 1 to 2. It goes away. Nobody knows about it. If you don't treat them, you go into this long period of latency. The boom, they come back tertiary. They've destroyed the virus. The bacteria has hidden and it has done damage to the circulatory system and the nervous system. Those are the keys: circulatory, cerebrovascular system, and the nervous system. These are the classic presentation of tertiary syphilis. They don't have rash anymore. They are not infectious. Usually they don't have lymphadenopathy anymore. Mental deterioration, yeah. They may have lymphadenopathy, but it's not generalized. They may not have febrile illness. This is what happened 1 to 2, stage 1 and 2, or first, tertiary, primary, and secondary, and when they are very infectious and they have cardiovascular disease. So third and fifth are the classic, what I expect in the tertiary syphilis. All they need is penicillin. What do you have here? The nurse should assess the client for development of which type of anemia. A lot of words. What is the problem? A nurse is caring for a client with post-Roux-en-Y. He has a gastric bypass. That's all. This is your stomach. I'll cut most of it, and I'll reroute your GI tract. And so I'm passing this resection or small bowel, basically, in your stomach. But the most important is the resection of small bowel, rerouting everything. What kind of anemia you're going to get? A plastic anemia is when you're getting, it means something is affecting the bone marrow. You have thrombocytopenia, basically anemia, and white count is low. Everything is low here. You don't have a plastic anemia when you have this. Anemia of chronic disease, as the name shows. You have a chronic disease and you have anemia. Like you have infection for a long time, you can develop anemia. Thalassemia, this is a genetic problem. So I'm not even going to talk too much about it. Sickle cell, the same thing, genetic problem. That's how you take your test strategy. What you left with, B12. This is why they take their B12 shots in patients who have Roux-en-Y gastric bypass. This is the problem. So you see how I can create a question like that. Like if you use test taking strategy, you can eliminate and get the answer right away. Next question. Which disorder the nurse should anticipate? A nurse is reviewing a client record with age-related hearing loss. That means it's related to your age. You can see, pay attention to the word age-related hearing loss. Okay, we all know Meniere's disease is a vertigo problem. There's no, it's just a acute onset, and it's not due to age. Something happened, fluid in your ear and causes imbalance, right? GIA, whenever I see GIA, I talk about pain. Otal is ear pain. So ear pain, it does not related to age-related hearing loss. Of course, opia is the eyes. So let's eliminate it. And therefore, you will be left with it. Presbycusis is due to age-related hearing loss. As I go, you see, I show you how I can answer questions. Some questions are free for you, and you got to use your strategy and eliminate. You don't even have to waste your time. Which teaching is appropriate? Select or apply. And next is providing teaching to a client post-total hip replacement. So the client has a hip replacement. So what teaching is effective? The main thing is you want to keep the legs apart. So you have a wedge here. Apart means abductor. So we want to keep them abductor. You don't want to bend up close to 90 degrees or minus 90 degrees at the waist. No way. That is flexion of 90 degrees. We don't want. These are the two things. So don't bring the two legs together and don't bend 90 degrees. So avoid crossing your leg, teaching appropriate. Do not bend greater than 90 degrees, teaching appropriate. Avoid low chair. Think about it. If I have to sit in the chair that is all the way low, I may have to bend close to 90 degrees. Problem. The word is avoid. So good. 10 other ways to pick an object. Nobody 10 other ways. And this is also bad for somebody who have had a hip replacement. So, and use standard height toilet seat test taking skills. If I'm wearing something that is low, standard toilet seat is also low. They have to have a double one. Not double, but something that can extend it. So there's devices you can put on your toilet seats and you don't have to burn and go low to cause deflection of 90 degrees. Therefore, standard high toilet seat is wrong. That's how you take a test. If I'm avoiding going low, toilet seat, I go low. So why would I have to do that? No. So 1, 2, 3 is appropriate teaching. Next question, selected and apply. Which room assignment indicates poor infection control protocol by the nurse? Keyword, same organism, not the precaution. And don't infect anybody. That's all. This is the strategy for rooming problem. 2 clients with scabies, enjoy. You guys can have your day. Yeah, same organism. Client with impetigo, client with conjunctivitis. They are what? Contacts. You want to put them together? No, they are not the same organism, right? Client with HSV and client with rotavirus, not the same organism, even though it's the same precaution. Client with scabies and tuberculosis, they're both not good. E. coli and C. diff, they are all contact. No. Question said, which infection control protocol is poor? Therefore, this is good, but then this is, so my answers are this. This is my answers. Remember, sometimes I flip it back and forth. So this is good, but it's not poor. They're asking you for poor, so I'll choose 3, 2, 3, 4, 5. So those are my answers. These are my answers because those are poor. The first one is good. Next question. This is a case, but I don't want to give you too many of them. I give you one. What is the presumptive diagnosis and your management? The client presented to the emergency room with left femur fracture. Okay, what is the problem? Client underwent open reduction internal fixation. That means we go and fix the bone, open the skin, fix the bone, and close the skin. So that's ORIF, open reduction internal fixation. This is the next note post of day 2. 2 days later, patient has temperature, severe pain, edema, swelling, tenderness at the surgical site. You have to think pain, edema, swelling, surgical site, buzzwords for infection, right? Client report chills. Now it's getting worse. Chills and malaise is like severe infection and drenched in sweat. What do you think? Bad infection. No shortness of breath though. And no petechia. This no will help you rule out something. What do you think? I have surgery and at the site I have so severe infection, I have chills, fever, everything. What do you think? It's not fat embolism. It's not compartment syndrome. There's no PPP. Why is no fat embolism? I told you there's no shortness of breath. And there's no petechia. Why do you want to pick it? Because you're comfortable with that? No. It's osteoanhydrous. There's only one infection here. It's not dislocation. It's anhydrous, infection. So all of this has an show infection. I'm picking anhydrous. If I have anhydrous, what would I do? Patient is sick. So we need to give them fluid to lower the temperature, make them MPO for now, and figure out what is going on before they get septic. They will need a bone scan to look at how deep involved. They need antibiotics. So these are all implied for your management. Next question. Selected apply. Which tasks need immediate intervention? That means we need to do something right away. The next team is made up of RN, UAP, LPN caring for a client with anemia who need transfusion. This is delegation issue. What do? Whenever you have these 3 people, everybody has to do their job. Don't cross the line. Even though LPN can do some vitals or anything like that, well, if the 3 is there, you got to give it to the appropriate person. Everybody stay in their lane. We don't cross over. You cannot help me. We have to do what we can do. LPN do MMR most. That means monitor, reinforce, teaching, most medication, ostomy, tracheostomy, and tube feed, right? And special test. LPN obtain the blood from the blood bank. We are not supposed to go take the blood from the blood bank. It's the UAP. So this need intervention. LPN and RN verify the blood type before transfusion. Yeah, there are two nurses. They can do that. UAP check the vitals 10 minutes after transfusion. They don't check the vitals after 15 minutes if the patient is stable. So this needs intervention. LPN 10 minutes after transfusion. So when you the transfusion has not finished after transfusion starts. So after you initiate the transfusion, they have to wait 15 minutes and it has to be delegated. 10 minutes is not enough. LPN check vitals 30 minutes after transfusion start. I know, but that's not their job. If the nurse can delegate to the UAP, fine. So this also need intervention. RN check vitals 30 minutes after transfusion when client complain back pain. If complain back pain, that's like transfusion reaction. Patient is unstable now. So the RN can check the vitals. After 15 minutes, they can delegate it to the UAP. But if patient is unstable, they can continue to check their vitals on themselves. So if 30 minutes has passed and they check the vitals because patient has back pain, yeah, that's okay. So I don't need to intervene that one. So no, but this, I need to intervene, this, I need to intervene, this. So the answer is 1, 3, and 4. I need to intervene. The last one is 5. It's fine. Next question. Prioritization. Who do you see first? I have trigeminal neuralgia and I have sharp, stabbing, facial pain. That's the definition of trigeminal neuralgia. You are being sharp if you're able to eliminate it. Trigeminal neuralgia is a pain issue. This is how the pain look like. It's not going to kill them. I have cluster headache and I have throbbing forehead pain. Yeah, that's the definition. I have pericarditis and I have sharp pain, chest pain with inspiration. That's the definition. There's no evidence of cardiac tamponade. I've not given to you. Just because they have chest pain doesn't mean you have to pick it. That's just because it looks scary. Pericarditis, heart problem, no. They just have inspiration, chest pain. That is normal. I have appendicitis, right lower quadrant pain. But what is the problem? With the butt-like abdomen. This is peritonitis. Yeah, you got to see this one. Next question. Which of the following need intervention? Selected apply. Client with a femur fracture using crutches on non-weight bearing status. They're not bearing weight, right? And they're using crutches. You have to know how to do the crutches, cane, or whatever. If you're using crutches, well, there's a way you can use it. Support your weight on your hand, not on your armpit. Otherwise, you get nerve palsy. So this one is good. Elbow flex 40 degrees, no, 20 to 30. This is too, the angle is too high. Crutches 16 inches, 15 centimeters apart. Yeah. This is where you carry them, one at least. Don't go past 6 inches and 15 centimeters apart. So I don't do anything. Affected leg and crutches move independently. Yeah, no. The affected leg is dead, and the crutches is what is supporting you. So these two need to move together, followed by the unaffected leg. Therefore, this unaffected leg move last. So this is good. So which one need intervention? Elbow angle and the way the affected leg and the crutches in a non-weight bearing, they have to move together. Okay. Those are the ones that need intervention. Next question. Which of the following the nurse should consider? Consider what? Select and apply. Okay, what is the problem? The client is in pulseless electrical activity. So I have PEA and a code is underway. So I have pulseless electrical activity. Which one should I consider as the source? This is pulseless electrical activity. That means the heart will have signal, but when you check their pulse, they have no pulse. What is the problem? Usually we call it H and T's. Most things that has a H on the end, like hyponatremia, hypernatremia, or hypokalemia, hyperkalemia. These are all acidosis or hydrogen ion. Those are all. And the T's, the bigger T's. So toxin is a bigger T. If you take a bad drug, it can put you in PEA, respiratory distress. And then like taking a downer too much. Tension pneumothorax, classic cause of PEA. And tamponade, yes, classic cause. This is pulmonary embolism. This is another T. We call it thrombosis. And these are the H. Hypothermia. If you drown and you cold, yes. If your fluid volume under, yes. And hypervolemia, no. When you have too much blood, there's no way you go to PEA. So these are the 1 to 6 causes of PEA. Usually hypovolemia, bleeding will cause PEA, but not hypervolemia. So they should not consider this. Next question, EKG. What is this? What is the next best action? The next best action. You can do all of this, but which one is the best? A client in the ICU for severe ARDS, monitor shows the rhythm below. The client in the ICU for severe ARDS, monitor shows this rhythm below. What do you see? I don't see P wave, bunch of QRS that is wide, and they are uniform. So it's not too sad. This is a VTAC. When you see a VTAC, first thing you should do, don't call a code, don't start a CPR, don't notify it, fill the carotid artery for 10 seconds. This is me trying to hide the answer. You just check the pulse. When you fill in the carotid for 10 seconds, it means you're checking pulse. So this is checking pulse. If you get pulseless electrical activity, then this becomes VFib. Okay, you have VTAC without a pulse, you consider a VFib and you treat it that way. Okay, so it depends on what you have with the pulse. So this is another question. This is always scary. So I'll show you how to answer it. Sometimes you get an answer, sometimes not. But there's some keywords you should focus on. Which documentation by the nurse is accurate? The client open eyes spontaneously. Keywords. Move extremities away when pinch. Keywords. And it's disoriented. So you have E, you have V, and M. The E is basically your eyes, right? If your eyes is spontaneous opening, without me talking, calling your name, touching you, pinching you or anything, that means you should get the maximum you can get. You can do it on your own. Therefore, you get 4. Right? The verbal, if you can completely involve in a conversation, you are oriented, you get the maximum 5. If you're confused, you can get 5. So this is disoriented, so you get 4. Modal means you move all extremities, you follow command, right? That's 5. If you move towards something, you get, they touch you and you have pain and move towards it, you get the 5. But if you move away, that's withdrawal. So the client move away from the pain. If the client move towards the pain, they get 5. Away from the pain, towards the pain means you localize. Away means you withdraw. So this client get 4. So they get this. And that's how you can do the 3 for eyes is basically sound. You hear, so it's wrong, right? And then the verbal 4, basically the 5 is basically they're doing the right thing, okay? They're not confused, disoriented. And 6, make you can follow command, and 5 towards it. So this is how you can do strategy to answer questions. So the answer is number 2. Next question. A client is scheduled for EEG in 24 hours. Which teaching is appropriate? EEG is to test for the brain function, maybe seizures, and other stuff. What do you have to know? You need to know this thing, some of the easy procedure thing, so that when they give you a question, you see that, oh, this is straightforward, right? Usually, we want to see your brain, abnormal brain activity, like seizures and other things. The procedure usually like for an hour, 60 to 90 minutes. So 20 minutes is too short. You have to wash your head to remove all the oily from it so that we can put a probe on your head. So do not wash your hair the morning of the procedure. It's not good. You will be bed rest for 6 hours. No, as soon as you finish, you just walk away. That's all. You don't need to, we are not inducing seizures. We just put in the probe and seeing what is going on. It's not electroconvulsive therapy. No. Why is 4 right? Sleep for 3 to 4 hours the night before. We want you to be sleep deprived. So this is key. Sleep deprived before you get the EEG. I don't want you to forget it. Be sleep deprived before EEG, because when you sleep deprived, your brain, you get abnormal brain activity, and that's we can see what is causing your seizure. Your brain start acting out, and then you're more able to trigger some of the things that is affecting you. Why are you going to get the EEG? So they don't want you to have a good night's sleep. They want you to have a abnormal night's sleep to keep your brain abnormal as much as possible, to elicit things that is already the abnormal foci. You are more likely to get seizures when you are not sleeping, and therefore because of brain activity, and because of that, we want you to do that. So this is the most appropriate. 58, select or apply. What do you have? Which of the following the next should include when testing Brzezinski sign, meningitis? The next is teaching a client, new graduate about that. Which should you include? You have to know this, the difference between this and Kenny sign, right? Patient has to be supine, and then your hands is behind the neck, okay, and bend the head towards the chest. That's all. So this, I care about this. So when I see B, I'm thinking about neck, and chest, neck and chest. So supine position, hand behind the neck, and bend the head towards the chest. When you're dealing with the hip flexion and knee, everything about hip and flexed, you're thinking about cannon. You got to have your own strategy. And if you see cannon, yeah, knee flexion. You see, there's a knee here, K-E-N, something like that. You can make something up. But cannon is knee flexion issue. So hip, flex, and knee, and then these are all cannon signs. So this is what you have to include. Brzezinski sign. I broke it down so that you can see what it is. Next question, prioritization. Which of the highlighted information need immediate intervention? Which one? A nurse is caring for a client after gunshot wound to the head in the ICU. The client has a ICP monitor in place already. 6 p.m. nursing note. Temperature high, bradycardia, hypertension, SAT 98, pupil rather fixed and dilated, urine output 1,000 over 2 liters. They are decorticating, posturing. That's bad. That's bad sign. Irregular respiration. This is chain stroke. Breathing. What do you think? Brain injury patient who is Brady, hypertensive with irregular breathing. This is Cushing triad. The patient is herniating. Which information need immediate intervention? Decortication, irregular breathing, SAT is fine, blood pressure, Brady, and temperature, which We don't want fever in them because you make them, but the most important are those we have highlighted. So 1, 2, 3, 4, 5. The saturation is fine. So these patients inhaling. What you can do is bag marks the patient and causes hypokalemia, a decrease their CO2 quickly. That will help them before they herniate, but it's too late. The signs they're showing, we got to act fast. So hyperventilate them to decrease their CO2 as soon as possible. Number 60, what do you have? Which of the following is a priority action? A client presents to the emergency room after 4. Client is on Coumadin, okay? Head CT shows large subdural hematoma, okay? This was immediately evacuated, okay? The client arrived in the ICU post-evacuation. What would you do first? Simple. You see, 5 lines. All I would say is somebody with subdural hematoma had a evacuation and now in the ICU. What would you do first? You check their pupil size, their GCS, their blood pressure, or check the incision. A, B, C. But not even that. In brain injury, oxygen and blood pressure is your key. You don't want to cause secondary brain injury. Whatever has happened to them has caused brain injury. Your job in the ICU, the reason why we monitor ICP and all things, we want to prevent secondary brain injury. So we want to prevent, and the key factors, if any of these drop, you're decreasing their you increasing their mortality and mobility. So oxygenation and making sure the blood pressure is normal is key. All these things we can do, but this is key. At the same time, you can go to ABC, A, B, C, D, E, right? Airway, breathing, circulation. So I do circulation before I do neuro, before I do extreme exposure and look at the incision. You can use that. I don't like doing ABC, but using content analysis to figure out that I need to check their blood pressure first. So the answer is number 3. Next question. Which action are appropriate? Select or apply. And this is caring for a client post chest tube placement for pneumothorax. Which actions are appropriate? If I have a chest tube, request for and what? X-ray. Anything wrong with it? Good. Educate client on deep breathing and use of incentive spirometer. Excellent. Tape the Prurovac on the floor. No, somebody is going to kick it. Check for continuous bubbling in the collection chamber. There should not be anything bubbling, even single bubble in the collection chamber. All you do, look at the name, E-collect. It does not need to be bubble. It's far away from the suction. Climb the chest tube for less than 1 minute if changing the Prurovac. Yeah, if you change the Prurovac, you just climb a few seconds, and then change the Prurovac less than 1 minute. So this is appropriate. You're not supposed to clamp it for a long time, but if you have to change the machine, yeah, clamp it quickly and then change it. So 1, 2, this is wrong, and 5. Next question. Select or apply. I know you're tired of select or apply, but this is to make you comfortable. If you see 85 SATA practice question, then when you go and take the test, this is a cocoa, nothing for you, right? Which teaching need immediate intervention by the charge nurse? Which teaching? What? A new nurse is caring for a client with new ileostomy. I have a new ileostomy. What teaching is very important? Chew your food well, so I don't need to intervene, right? Empty the appliance before your meal. Yeah, if you have something in the appliance and you eat, it's going to get full and you change it, it become a problem. You will leak. So before you eat, change it. I don't need intervention. Separate your liquid from the solid. Yeah, you eat your solid first, and then after that you drink. Otherwise, you will flush it. So this is good. Irrigate ileostomy. Ileostomy does not need to be irrigated. It's only colostomy. This is ileum. Increase your hydration. Yes. So this need only one answer. So you pick those you're confident. Don't just pick because there's 1 to 5. I intentionally said this, but this is all the select or apply. You pick those you think you're confident. So number 4 is the right answer. Only one answer. What do we have? Which of the following will be most appropriate? Why? A client needs oxygen delivery device that can supply what? 5 liters of oxygen. Client at the same time want to eat, talk, and ambulate while on oxygen. Well, we have a problem. This rebreather, no, it's not comfortable. You can, it's the partial one. You can eat at the same time. No, you can do that. You may have to take it and you desaturate. Non-rebreather is the same thing. Partial rebreather means there is an area where you can rebreathe your own oxygen back and forth. Non-rebreather doesn't let you do that. Ventral max is very good to give you precise oxygen delivery, but all of them can give you 5 liters. They have different saturation, but the problem is the way the patient is trying to want to eat, want to walk and do all those things. You can't do that with all of them. So that is the problem. So this is your right answer. Nasal cannula is the best device for this problem. The client needs precise amount of oxygen delivery due to hypoxia. Which of the following the nurse will select to achieve the oxygen? I've given you the basically the idea already. So nasal cannula usually it will deliver like 5 liters, and you can get like 87 to 95%, but it's not precise, right? The same thing, partial non-rebreather machine can also give you 6 to 11 liters. They can give you that much, and your saturation close to like 40 to 70, 76%, no, to 90%. They can do that, but it's not precise. Same thing as the non-rebreather can give you up to like 60 to 15 liters, and the saturation 50 to 90%, but it's not accurate. You know, this one, ventral mass, is very good. It can give you 4 to 12 liters of oxygen, and then your saturation percentage of FiO2. This is percentage of FiO2. Basically, this FiO2 percentage that is supply 64%, but it's very, very specific. The percentage, like I said, is FiO2. So these are fraction FiO2, not your oxygen saturation. That's FiO2. So the best device to give you, they use the word precise, is this. So these are all FiO2 oxygen that is being delivered. Even though they are high, they are not specific. This is the best one for specific delivery as requested. Next question, selected apply. Which of the following will make the next question the prescription? Why? The client with severe asthma was prescribed what? Theophylline due to recurrent flare. This metazantates, basically, they are very, very good for long-term asthma. So I see that as a long-term asthma. There's how you can recognize them. They're very dangerous. They cause seizures. Another thing they have narrow therapeutic index. You have to follow them. The way I remember them is 4 C's. Okay, 4 C's, right? Anything that affects your liver. So cirrhosis. Okay, so cirrhosis, right? If I drink 4 beer a night, yeah, you're affecting my liver, right? Coffee. Patient went to Starbucks. He cannot go without Starbucks coffee, right? Then ciprofloxacin. This antibiotic, don't take it with it. And then antacid. It's also specifically the cimetidine. Cimetidine, ciprofloxacin, coffee, and cirrhosis or need to be intervened. This is how you can recognize theophylline. What are the contraindications for theophylline? Cirrhosis, coffee, ciprofloxacin, and cimetidine, the 4 C's. So the next question order. What do you have? Select or apply. And next, know that the PCM will make medication, will make medication. So this you say medication adjustment based on the lab work. So medication adjustment based on the lab work. Patient is on what? Atorvastatin. So which of these we want to adjust? Usually you want to keep your LDL less than 100, right? Your triglyceride less than 150, your HDL higher, greater than 45, total cholesterol less than 200. So which one we think will make adjustment? LDL is still high. Triglyceride is okay. HDL is too low. Cholesterol too high. Fasting glucose has nothing to do with cholesterol. So even though this may be too high, don't pick it. Test taking skills. Question is asking you about atorvastatin. It's for cholesterol control. This will not cause the doctor to change atorvastatin. So it's the trap question, trap answer choice then. Okay. Next question. Which of the following intervention is indicated or not indicated? The client was prescribed what? Furosemide for CHF. The client report what? Weakness and fatigue, one group of BASVES. Next assessment, steady pulse, something is going down. Shallow respiration, going down. Hypoactive sign, going down. You see a U wave, this is the case form. Prolonged QRS and flattened T wave, the T wave is not peaked. It's flattened. What do you think? Go back to the source. Furosemide causes hypokalemia. These are signs of hypokalemia. Even if I don't give you furosemide, I try to make it easy a little bit, furosemide, and I don't give it to you. Look at it. All this is like not consistent with anything that will lead to EKG changes that will be related to hyperkalemia. Hyperkalemia, you have peak T wave. This you have flat T wave. And the bowel sounds going down, everything going down. That means it's hypokalemia. This is a hypokalemia problem because of LASIS, right? Furosemide. What do you do? So low K. What is your management? You give them albuterol. The side effect of albuterol is hypokalemia. You cure them. So this is not indicated. You give them insulin, you cause them hypokalemia. Insulin decreases your potassium. Give them K-isolate, we are in trouble, not educated. It will lower your potassium. Calcium gluconate, this is going to stabilize your heart. It will make your heart stabilize to prevent the EKG changes. So this is good. And then you replace the potassium. Okay, slowly as much as possible. But this is a good question, testing your knowledge how to recognize key facts. Okay. And then she's teaching new graduates about antidotes and treatment of poison, right? That's what she's doing. Which of the following teaching is appropriate for a 10-year-old with lead poisoning? So which one is appropriate? Syrup of Ipecac, we stop giving it. All it means is kid has lead poisoning. So which teaching do you provide? We don't use this anymore. Syrup of Ipecac. Every time you see this, just cancel it. Activated charcoal, you don't want to induce vomiting. Protamine, you know this is for heparin. These are the medication you use for, if you never heard about them before, democarpol, succinimide, D-penicillamine, and EDTA. If you never heard it, just take a picture of it. These are for medication. They are chelating agent that we can use to treat lead poisoning. So 4, 5, 6, and 7 are your answers. They're easy to recognize. No problem with them. 69, select or apply, right? A client present with this rash shown below. You have this. What would you do? Which of the following is appropriate? What do you think? This is bullseye. You see, there's clearing around the center rash and it's moving away from the original source. This is what we call bull's eyes. What do you want to do? It's not infectious. I don't need contact precaution. The nurse wear a gown and gloves. I don't need contact precaution when taking care of the patient. Okay. Disposable, single-use equipment. I don't need contact precaution. The door does not need to be closed. It does not need contact precaution or whatever. It's not infectious. It's a tick. You get bitten by the tick. Prescription for doxycycline to prevent the effect of cardiac and neurological problems. So select and apply, pick those you know. But if it's tripping you, don't pick it. So only one answer choice there. Trap question. Number 70. What do we have? A MedSurg unit has 4 clients. Which client should be assigned to a LPN? Client post appendectomy awaiting discharge. Discharge is usually done by the RN, so cannot do that. Client with admission for MI. Admission assessment has been done by RN. Client with tracheostomy receiving amiodarone drip. They can take care of tracheostomy, but amiodarone drip make the patient unstable, so RN has to do that. Client with dysphagia is just receiving TÜV, so they can provide TÜV through that. They do TÜV training easily. They can touch the TÜV. They can give patient TÜV, no problem. Next question, 71. Select or apply. RN, LPN, UPN, UAP are caring for a client with ileostomy, gastrostomy, tube, and a Foley. Which tasks assigned by the RN to the UAP need immediate intervention? That means something is wrong. You should not give something to the UAP. Record urine output, excellent, no problem. Go and pick tube feed from the pharmacy. Yeah, they just go and pick it. They don't require any thinking. Empty the stoma? No, they can't touch the stoma. Record oxygen saturation? Yeah, they can do that. They don't monitor anything for aspiration. Okay. The word monitor changes it. You can change it, but you can say observe is different from monitoring. You know, so monitoring for aspiration, yeah, that's not good. You can do that. We need to intervene. We need assessment. Which of the following the next should include? Okay. Which of these you should include in the based on what is being given? The next is teaching a new graduate about hypertonic solution. Okay, so which one you should include? Hypertonic is the way to remember is anything greater than 1% or 0.99% normal saline. This is greater than 1. So this is, yeah. Which of the following the next should include? 3% is greater than 1%. If normal saline is 0.9, when you had D5, it's now greater than 1%. The same thing, LR is isotonic. When you have D5, it becomes hypertonic. D5W is not. Okay, D5W is not hypertonic. It can be isotonic or hypotonic. So this one is wrong. So 1, 2, 3, 4 is the right answer. Next question. Which assessment is a priority? A nurse administered mannitol and 3% normal saline to a client. What should be your priority? Mannitol hypertonic solution, 3% hypertonic solution. What is going to happen? This hypertonic solution sitting in your blood is going to pull all the fluid into them to dilute it. This is why we use it for the brain, head injury. Now you have large fluid volume. What happens? It go to your lung. Your lung will say, oh, where is this, all this fluid? You go pulmonary edema or CHF. So whenever you give somebody with hypertonic solution, watch for what? Their blood pressure will go up, their urine output will go up, their leg will go up. Priority, yeah, be sharp. Pink fluid sputum. This is a trap question to see if we can figure out. It means pulmonary edema. They are drowning in their lung. This is your priority. So all these things will happen, but this is my number one, pink fluid sputum, fluid overloaded with pulmonary edema. Number 3 is your right answer, prioritization. Next question. SATA, which of the following is isotonic solution? That means it's close to the blood volume, 0.9% normal saline, LR, they are isotonic. But D5W, when it's sitting on the table, so D5W is considered isotonic. When you put it in the blood, the sugar get broken down, and now it will become just water. Hypo, it become hypotonic. Once again, when D5W is in the bottle sitting there, it's isotonic. When you inject it and infuse it in somebody, it becomes hypotonic because the sugar get removed and it's just water. So a D5W in the bottle is isotonic. Normal saline in the bottle is isotonic. LR in the bottle is isotonic. Infused D5W is hypotonic. D10 in the bottle, this is hyper, it's too concentrated. So 1, 2, 3 is your right answer. Next question. Positioning. Select or apply. 5 patient, I guess it's 6 patient. Need to be positioned post procedure. Which position need immediate intervention? After the procedure, you've done something wrong. A liver biopsy, the liver is on the right side. After the procedure, you should put pressure on the liver, put them on the right side. This does not need intervention. The kidney is on your back. After the procedure, you should put them on their back so that they can hold pressure. They are on their left side. This is a problem. Lumbar puncture. Lumbar puncture, they go right in the middle. If you did the puncture after the procedure, you should put them pressure on it, put them supine. So this is good. Left thoracentesis. This is your lung. I go there, I puncture it here. I've injured your lung. After the procedure, I need to allow that lung to recover. So that lung should be on top, not down. So if they put the right side down, this is good. If they put the left side down, that's wrong. Left groin angiogram. I go into your left groin. After the procedure, that leg needs to be flat. So this is good. Mastectomy, and the patient is in a semi-phalanx position with the affected leg on the pillow. This is the way it's supposed to be. Excellent. So select it, apply. If you know, you pick it. If you don't and it's confusing, leave it. You see, there's only one answer choice. I intentionally said it that way. If you pick more, you get it wrong. Next question. For clients with chest tube, they have chest tube who need immediate intervention based on information. So the best way to remember this is if you have a chest tube, I don't want you to forget this number. 5 to 10 ml, okay, per kilo per hour. If you get anything more than that, more than 5 to 10 ml per kilo, there's a problem. Or you can do greater than 3 ml per kilo for 3 consecutive hours. So 1 hour, 2 hour, 3 hour. This one is a little bit difficult. I like this one. Therefore, what is the problem? Take the first patient. They have 300 over 70, right? And what does it give you? You just have to calculate. So 300 divided by 70 will give you 4.3 ml per kilo per hour. They all have 1 hour, so the same. So that's why you can cancel it. This is less than that. So this patient is good. This one, 200 over 70 will give you 2.8. So I'm good. 60 over 10 will give you 6. Right away, you know it's greater than that. So I'm picking that answer. And if you do this, you get 4 ml per kilo per hour. And that's how you know. So it's not the amount, it's the relationship to the weight. So even though these people put a lot, they're bigger. So that's fine. This one is small, 10 kilo person putting 60 ml is a problem. So pay attention to that. So that one need immediate intervention. They're bleeding. Number 77. What do we have? Which statement may need immediate intervention? Select or apply. They like DVT stuff or anticoagulation. A client prescribed apixaban. So this is direct factor 10 inhibitor for new onset DVT. Which statement need intervention? The medication will prevent new clot formation. Yeah, that's what anticoagulation does. Medication will stabilize the clot already formed. Yes. Medication will burst the clot. They are not clot busters, so they are not lysing. They're preventing new formation. The medication will increase my bleeding risks. Excellent. The medication will work better if I stop eating green leafy vegetables. This one, you don't need to change any diet. No, those factor 10 in. The only thing diet is a problem is coumadin. And even not the problem, all you need to do is don't change anything. Even though that's the only one, still don't change. It's a confusion statement. But you don't change anything. Same thing for and a PCBAM, you don't even have to worry about fresh leafy vegetables. It does not affect it. So 3 and 5 is your right answer. Need intervention. Next question. A nurse is caring for 4 clients. Which client is most at risk for postpartum hemorrhage? PPH. PPH, I call it tone. Tone is your problem. Okay. And thrombosis. There is a couple acronym about 4 T's. But if you have tone problem, and what is tone? That means the uterus cannot contract. So it's distended or it has atonic. It does not have tone to contract anymore. G2P1, 12 hours post-delivery. There's nothing complicated. They have like normal delivery. So G2P2, and you have C-section due to difficult labor. Yeah, the labor was difficult, so they are C-section so that they do not have to progress and make the uterus more atonic. G2P2 delivered 2 twins. 2 twins will make the uterus bigger and bigger. But then you have prolonged labor. That means this is greater than 24 hours. When they use prolonged labor, it's a long labor. So the longer the labor, the number of gravities, and the using tocolytic and then prolong, what do they call it? A bunch of people in the uterus that make it dilated. Yeah. If you have history of bleeding, it does not mean you're going to bleed. They did not tell you that the patient has prolonged labor, they have multiple twins, anything. So I'll pick this. Number 80. This is insulin question. Which of the following is a rapid acting? You know that, right? This is intermediate. These two are long acting. So you're left with this. Number 4. Simple, straightforward question. You don't have to waste time. Number 81. Select and apply. And this is caring for a client with rubella infection. This is true measles, right? Which of the following is indicated? But it's measles, it's airborne, it's not droplet. Vaccinate the client, you already get infected. You don't need to vaccinate them anymore. Next, wear N95 because it's airborne. Vaccinate family members within 72 hours. Yeah, those who may be exposed, within 72 hours, take care of it. Vitamin A supplement, this is very important. Measles will decrease your vitamin A and it will cause more blindness. It increases your ability to be blind because it decreases vitamin A deficiency and vitamin A related blindness due to measles. Because of that, you need to supplement it. The pathogen is very smart. It can accelerate blindness if you don't treat it. Anti-itch lotion for the rash. What do you think about this? Anti-itch lotion for the rash. The rash does not itch. That's the trap. So it does not itch. So you don't need anti-itch lotion. It does not itch, so don't worry. So which of the following is indicated? 3, 4, 5 are your right answer. Next question. Case form. Which of the following is indicated and not indicated? A nurse is caring for a client with lymphoma. Chemotherapy was initiated. The client developed Basware, tetany, seizures, acute renal failure, and peak T wave. Think about it. Peak T wave, you always know is potassium. Tetany and seizure, this can be like calcium excitability, right? Renal failure, something is blocking the kidney. Uric acid. Where is this coming from? This is the cell. I give it chemo, right? And the cell burst open. And all the content. What is the content? Uric acid from DNA, right? Potassium usually in the cell. So you have more potassium. And then phosphorus, more phosphorus. And what that phosphorus does, decrease your calcium. So these are the lab work you get in tumor lysis syndrome. This is tumor lysis syndrome. This is what you see. Uric acid is high. This go and affect your kidney. Potassium is high, causes the peak wave. Phosphorus is high, causes other problem for you. And then calcium is low, causes tetany and seizure. So what is indicated? IV fluid. Flush the blood system so that you can affect the renal failure. Raspberry case. Raspberry case is to help with the uric acid. It does the same thing as allopurinol. So raspberry case, if you have not seen it before, it helps with preventing breakdown of uric acid. So this is indicated. So as allopurinol, they do the same thing. Telemetry, just pick T wave. Give him tele. Spironolactone, what does it do? Increases your K. You want to increase more K in this peak T wave? No. Savilamin. This is for potassium A, phosphorus binder. So it binds your phosphorus. Calcium acetate will also improve you decreasing your phosphorus. When you give them more calcium, it get rid of the phosphorus. So, and at the same time, their calcium is low, so replace it. So this is what is indicated. This is not what is indicated. Straightforward question. Next question. Which of the following has the highest risk for renal calculi? Think about it. And this is teaching new graduate about risk for renal stone. So renal stone, I'm making stone in my kidney. Most stone will have calcium in it, right? Kidney stone, right? Cushing disease has nothing to do with stone, and it does not affect your calcium. Prescription for calcitonin You have to know this function. This one stabilizes the bone. It does not allow calcium to be released. That's what we use it for hypercalcemia or osteoporosis. Same thing of alendronate. It stabilizes the bone, prevent calcium release. Therefore, there's less risk for calcium stone. Hyperparathyroidism, yeah, you're making more PTH, you're releasing more calcium, you're decreasing your phosphorus, and this go and form stone in the kidney. So this one. Next question. Which of the following the NCLEX should include? What should I include? Why? Select or apply. Okay. And this is teaching new graduate about science of fluid overloaded. These fluid overloaded and non-fluid overloaded, they are straightforward questions. You fill in the tank. How can your pores be thready? If you don't understand the word, then you should look for some of them. Thready pores, these questions are straightforward. I'm filling the tank. Your vessel is going to be full. It's full. Like you think about it. Use this as an analogy, filling your car tire. There's no gas in it, or no gas. There's no air in the tire. You fill it, you can palpate the pores of the tire, right? Your leg edema, the tire look big. Hypertension, yeah, the pressure in the tire is high. Tachycardia, it can go faster, right? Of course, you can have crackles in your lung, get into trouble. There's no way the tire will be mad. You know, you're not going to get testy. You don't want to drink more. The tire doesn't want to be filled with air anymore. It's all balloon up. And your cap refill should be not be greater than 3 seconds. That means it's slow. No. So the 2, 3, 4, 5 are your answer choice. Right. So which of the following the NCLEX should include a capillary refill greater than 3 seconds? That means it's too slow. You want it faster. So it should be normal capillary refill. You don't have to long crackles, tachycardia, hypertension, leg injury, pulse, and not. Next question, number 84. What is the priority action by the nurse? A nurse is caring for a client who is do not resuscitate, DNR. Review of the chart shows an expired. The order as expired for DNR. What would you do? If you're taking care of the patient who has an order that is expired, you sit on it, well, he's going to code and you don't know what you're going to do. Assume order is still valid despite expiration. We don't assume anything. Tell the incoming nurse, she's not going to do anything. We need to fix this problem. If the patient code, we don't know what is wrong with it. What are we going to do? Or the provider to verify the current status of the patient. Probably the provider talked to the family and said, yeah, we don't need to put on a DNR anymore. So let it expire. Yeah, this is good. Ethics committee, they have no clue what to do with this. And the last question. Last question, as you can see. Okay. So this, for the 25-year-old client, slanted test result shows OD, OS, and OU. Which statement from the nurse is appropriate? Select and apply. When you see OD, this is a Latin word for right. OS, Latin word for left. OU for both of them. So they look at your right eye, your left eye, and then both eyes. OD is right, so this is good. OS left is good. Right eye is better than both eyes. What is the right eye? Right eye is 20, 25. Right? 20, 25. That means you can see an object at 20 feet, but the rest of the population can go to 25 feet and still see it. But when the right eye is being looked at, it's comparable to the rest of the general population. So right eye is better than both eyes. The client does not need glasses. 20/20 on both eye, 20 on the right and 20/30 on the left, and both 20/25 is fine. That's no need. So there's our right answer. This is wrong. This is the end of it. Thank you for getting to the end. If you've been subscribed, subscribe down. And I hope you gain something out of it. A lot of content, a lot of information. Keep charging as always. Subscribe to Adapt NCLEX and look out for more of this. Thank you very much and all the best of luck. Bye-bye.